One of the biggest challenges and opportunities for society today and historically is how do we effectively support parents to support children's healthy development, specifically children's healthy emotional, behavioural, social and academic development. Traditional strategies have focused on supporting the parent-child relationship and equipping parents with effective parenting skills. My research has brought attention to the importance of the relationship between adults themselves and how supporting that relationship not only improves mental health, academic and other outcomes for children, but actually significantly enhances the quality of the parent-child relationship for children. We know that rates of serious mental ill health among young people are going up. It's estimated that 1 in 4 children and adolescents experience very serious mental health problems. Our research has highlighted that conflict, acrimonious exchanges between adults can affect young people as young as 6 months. To use a modern term, there's still no greater influence or influencer for a child's life than their parent or parents. We cannot do enough to help inform adults what really works. So the research that I have led over the past several decades has facilitated a new policy area coordinated by UK government, specifically Department for Work and Pensions, called the Reducing Parental Conflict Programme. So we have developed intervention programmes and we focus on addressing particular difficulties that adults experience in their relationships that are common to most relationships, when evidence to adults as to how they manage particular challenges and how the management of those challenges are observed, heard, experienced by children and adolescents, we see quite significant energy and enthusiasm to learn more.
Professor Harold was absolutely brilliant in helping us communicate with ministers, like why is parental conflict a problem, and then making the case for how government can help. He was brilliant in helping us sift through the different interventions that had worked across the world and identify which of those ones could we actually test in the UK context. And then the third magic ingredient for social policy and government is evaluation. And he led an evaluation for us on this programme as well. So his work was really critical to us in government.
Perhaps the biggest impacts on the ground is that 31 local authorities in England, more than 16,000 practitioners, leaders and managers have directly participated in community or practice training. And more than 5,000 parents and 3,000 families have participated in one of 8 intervention programs, with evaluation evidence showing that parents who participate in one of those 8 programs, that their children show significant improvements in mental health outcomes.
What I think we've seen both through the training that's been offered by DWP and Gordon's continued work and interest in here is that we've developed a really curious workforce. So the workforce now is always thinking what's behind the behaviour, that we don't react to the behaviour, we react to the cause of the behaviour.
We're currently working with other government departments, Department for Education, Department of Health and Social Care, Ministry of Justice, to help share the research to a wider set of policy targets. And we can help young people today through this research. We enhance, promote the prospects of those young people become healthy, well-functioning and productive adults.